Daejeon Government Complex with simultaneous interpretation available in English. So as you can see, we're now going into the briefing room where Kim Gang-lip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the coronavirus situation in Korea. So that should be starting in just a few moments from now. And Vice Minister Kim Gang-lip has taken to the podium, so it looks like the briefing is just about to begin.
We also have Mr. Lee Byung-chul with us, and we have sign language translation available as well. First of all, here is Mr. Kim Gang-lip with the briefing on COVID-19 response. Let us now begin our regular briefing for May 22nd, Friday. As of today midnight, we have a total of 20 new cases, and including Itaewon case, and the local transmissions are at 11, and the rest are imported cases. And as of today midnight, the total number of confirmed cases now stands at 11,142, and a total of 10,162 have been discharged following full recovery. And we have 716 people in quarantine undergoing treatment. And we hope that they can recover as soon as possible, and I extend my deepest gratitude to all of the medical practitioners. And the death toll remains unchanged from yesterday, and the death toll now stands at 264. This morning we had a KCC meeting presided over by Health Minister Bang Neung-woo, and we discussed the measures for the quarantine at the high-risk facilities, as well as the measures for the resumption of offline classes for the seniors of high school students. And Health Minister Bang Neung-woo has stressed that in order to guarantee a safe environment for students at schools, it is very important to cooperate among the schools, the public, as well as the entire community. And if there are any suspected symptoms, we need to have these students tested as soon as possible. And we also urge people to avoid visiting singing rooms, PC rooms, and other high-risk facilities around the school area. And this morning at the KCC meeting, we also dealt with the issues of the increase of confirmed cases in the metropolitan area. In relation to the Itaewon Club case, we have over 77,000 cases that have been tested, and as of now, we have a total of 207 reported cases as for the Itaewon-related case. And since the first identification of the patient in Itaewon, the cases tied to the clubs have not evolved into explosive infections, but we have continued to increase steadily. And especially at the metropolitan area, including Seoul, we have seen that there are additional infections through the mediums of karaoke rooms and other multi-use facilities. And we are eyeing on this outbreak and monitoring the situation, and we exert our full efforts to swiftly identify the confirmed cases at an early pace, as well as conducting our massive and swift testing of the coronavirus. And we are also making sure that we do not lose and we do not leave behind any of the chains of infections, and we are also striving to make the situation stabilized. And in the process of epidemiological investigations, we are disclosing the whereabouts of the confirmed cases. And if you have visited the same places at the same period of time, we ask you to go to the screening clinics to get tested as soon as possible. And looking at the recent outbreak, we are seeing that the outbreak is happening through multi-use facilities, including PC cafes, singing rooms, bars, and restaurants. And we have been putting emphasis on the fact that we did not have a much high level of quarantine inspections or quarantine measures. And on the other hand, we had great concerns about the possible infection at the Samsung Medical Center and the Yongin's Gangnam Hospital. However, they did not lead to additional infections. virus. We are also in the completion stages of the screening testings for the Samsung Medical Center. However, we do not see additional confirmed cases as of yet. And this is the same with the Yongin's Gangnam Hospital as well. And the situations are also very similar with other facilities, including Seongnam Medical Center, as well as the high schools and the technical schools, and also other facilities that we have identified. And this gives us a hope that early diagnosis of the patients could help us to overcome the disease as soon as possible. And thus, we ask the members of the public to continue to act as a responsible agents of quarantine, and we believe that this can help us overcome the virus. And until we have an effective therapeutics and vaccine against the virus, it is difficult for us to terminate the virus. And experts here at home and abroad say that we can't have a return to our routine daily lives until the end of the COVID-19. And this means that we will be experiencing sporadic outbreaks of the virus going forward. And we also ask the public to, instead of having extensive or excessive nervousness or fear against the virus, please act with vigilance and discipline. And as for the civil servant testings that were carried out last week, more than 10,000 students have been taking part in these testings. However, we did not have an outbreak, and this was all possible thanks to the dedication and efforts put forth by the test takers and the quarantine authorities. And based on these experiences of success, they need to go further, and they need to be exchanged and shared with the rest of the international community. And as we stabilize such order, we believe that this can be a new normal within the post-COVID-19 era. And at today's KCC meeting this morning, we also discussed our quarantine measures for high-risk facilities. And so far, the distancing in daily life guidelines were just recommendations, and they did not have a legal binding. And these were some of the criticisms against such guidelines. Therefore, we carried out the risk assessment for the facilities, and we identified the high-risk facilities, and we implemented more detailed measures of guidelines for these specific places, and having a more enforcement of these guidelines. And we were carrying out these assessment of environmental risks depending on based on the size and confinement, as well as the ventilation of these spaces. And we will be designating 9 facilities, including the bars, clubs, as the high-risk facilities. And if they are designated, we will be alleviating these designation by the municipal government's decision and final decision. And these will be implemented depending on the seriousness of the infections. And especially at these high-risk facilities, we will be laying out some of the guidelines that need to be carried out, and they will be mandatory. And these include entry log, a screening of the body temperatures, and an enforcement will be carried out. And especially for the bars and clubs, as well as other nightlife entertainment venues, we will mandate all of the visitors to write their name and telephone number accurately. Moreover, as for the list of the entry log, they will be utilized with the ICT so that we can manage and control these entry logs going forward. And going forward, we will continue to work closely with the related institutions and organizations to lay out detailed measures. And as for the details, please refer to your press kit. And next is the resumption of offline classes for high school seniors. Yesterday at the Education Ministry, we have said that starting from May 20th, on the first day, a total of 2,300 schools nationwide, we had about a majority of them returning and resuming their offline classes successfully. And most of these schools abided by the quarantine protocols, such as wearing of the face masks and washing of their hands. And they also closely cooperated with the fire department and the police department and are carrying out swift and massive testing if anyone is suspicious of COVID-19. And we are also closely cooperating with the psychological consultation centers so that we can ease the students' nervousness and mental nervousness about the fear of the COVID-19 virus. And as we see a rise in the temperature, and as we know that, and we acknowledge that it is difficult for our students to wear the face mask at all times, considering their activities on the school grounds. And considering these environment conditions, we will be revising our guidelines for face masks for students and teachers soon. And yesterday, we have had a consultative meeting with the 7 representatives of the religious circles here in Korea. And they have also encouraged our KCDC as well. And they also mentioned that they have participating in the social distancing measures by delaying or scaling down the size of their celebrations, including Buddha's birthday and Easter holidays. And we also want to extend our deepest gratitude to all of them for participating in our measures to carry out this social distancing. And we need to also remember their dedication and sacrifice. And going forward, we ask you to continue to comply with our quarantine authorities as well. And we believe that many of the public will be fatigued and very tired of the prolonged outbreak. However, we ask the religious circles to give them more encouragement. And next is a few words about the resumption of offline classes for high school seniors. After they returned to school, they were talking with each other in close distance as they have been missing each other for a very long time. We understand this, but they need to comply with our quarantine protocols, including wearing of face masks and social distancing. You need to remember this, and the students also need to continue to comply with the quarantine protocols at school area. And we also ask the students to avoid visiting singing rooms, PC rooms, or other facilities that are enclosed and small and poorly ventilated. And we also ask the teachers and staff members to avoid going to PC rooms, singing rooms, bars, or clubs going forward. And as for teachers, we also ask you to encourage the students to stay vigilant and to comply with the quarantine protocols. And we also ask the schools to make sure that there are no further discrimination and stigmatization of the confirmed cases at school areas. And in order to guarantee a safe environment for our students, we believe this calls for a public support and participation. If each and every one of us keeps with the distancing in daily life measures, we believe that you can also help us win over the COVID-19 outbreak. Thank you very much.
That was a live briefing from the South Korean health authorities. You just heard there, updating us on the COVID-19 situation here in the country. We just heard that there were 20 new cases of COVID-19 here in South Korea, bringing the total accumulated number of cases to 11,142. There were no new deaths, meaning that the death toll stays at 264. Well, that wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular newscast at 12 p.m. Korea time. Bye-bye.